Hi everybody, my name is Morgan Minnich and my project is on improving postoperative pain and assessment reassessment practices through nursing education. This project was completed on my unit at Duke University Hospital on 3100, which is a gen surg floor. This was done under my mentor, Amanda King, and the purpose of this project was to improve nursing staff knowledge and self-reported compliance with evidence-based post-operative assessment and reassessment practices. Why pain matters? Post-operative pain management is a critical component of nursing care. Inadequately assessed or managed pain can delay healing, reduce patient mobility, increase complications, and negatively affect patient satisfaction. Nurses are responsible for assessing pain and reassessing patients after interventions to determine the effectiveness. Discussions with staff and my mentor revealed opportunities to strengthen knowledge regarding standardized reassessment practices, creating the foundation of this project. The goal of this project was to improve nursing staff knowledge and self-reported compliance with evidence-based post-operative pain assessment and reassessment practices by at least 20%. To achieve this goal, 3 objectives were established. The first to focus on designing an educational intervention. The second involving implementation of the intervention over a 2-week period, and the third is to focus on evaluating the effectiveness of the intervention through surveys, feedback, and mentor feedback. The design phase. This began with a review of the current literature related to post-operative pain management and nursing education strategies. I found 5 peer-reviewed scholarly articles that analyzed and identified best practices. I also discussed current practices with my nursing staff and my mentor to identify gaps related to pain assessment and reassessment. Based on these findings, I also developed an educational handout and summarized evidence-based recommendations and created pre- and post-intervention surveys to measure the knowledge and self-reported compliance. The literature consistently demonstrated that accurate pain assessment and reassessment contributed to improved patient outcomes. Research showed that nursing education interventions can significantly improve staff knowledge and adherence to best practices. Several studies highlighted and reassessed following pain interventions is frequently overlooked despite being essential for evaluating treatment effectiveness. These findings supported development of the educational intervention. The implementation phase. Following approval from my mentor, the educational intervention was implemented. Staff members received educational materials, the handouts that I created, that focused on standardized pain assessment, reassessment timeframes, documentation expectations, and non-pharmacological pain management strategies. 4 nurses participated in the educational intervention and completed my surveys. The implementation period lasted 2 weeks, allowing staff time to review and apply the educational content. And the evaluation phase. At the conclusion of the implemented period, post-intervention surveys were distributed to evaluate changes in staff knowledge and self-reported compliance. Survey responses were compared to baseline results, and the feedback from the participating nurses and my mentors was also collected. These data sources provided information regarding the effectiveness, feasibility, and overall value of the intervention. My project outcomes. Alrighty. This survey demonstrated improvement in nursing staff knowledge regarding post-operative pain assessment and reassessment practices. Participants reported greater confidence in identifying appropriate reassessment intervals and documentation requirements. Staff feedback indicated that educational materials were easy to understand and applicable to daily practice. Based on the survey results, the project goal of improving staff knowledge was achieved. Impact and lifelong learning. This project strengthened my ability to lead a quality improvement initiative from planning through evaluation. I gained more experience conducting literature reviews, developing educational materials, and analyzing outcomes and presenting evidence-based recommendations. These skills will support my future role as a professional nurse and continue to my ongoing commitment to lifelong learning and quality improvement. And these are my references. Thank you guys for listening.